Hello, everyone. Welcome back to the Resilient Aging Unfiltered podcast. I'm so excited to talk to Dr. Dana Gibbs today. Welcome, Dr. Gibbs.
Hi, it's so great to be here. Thank you for inviting me.
Same. I've learned so much from you in the short time I've known you. So I'd love to share with everyone Dr. Gibbs' bio briefly. So she has a lot of expertise in a lot of things. She is a board certified ears, nose, and throat surgeon, otherwise known as otolaryngologist. She's a thyroid expert and hormone health advocate, combining the best of science, 30 years of medical experience in whole person care. Her personal experience of undiagnosed thyroid imbalance led to profound changes in the way she practices medicine. I love that. And then her approach is rooted in data, not dogma. She uses advanced testing, T3 inclusive thyroid, menopausal hormone therapies, and targeted lifestyle strategies to restore energy, focus, sleep, and resilience. Wow. And then she and her team believe that your symptoms are real, your time is valuable, and your care should be as comprehensive as your story. Wow, that's beautiful. And we don't hear that very often in our healthcare system, do we? So she has a podcast also called Beyond the Thyroid, where she educates patients and fellow healthcare providers about integrative thyroid care, emphasizing the importance of personalized treatment and patient empowerment. Wow, what an honor to have you here. Thank you.
Thank you for having me.
Well, I'd love to start by asking about your story and what you don't hear about otolaryngologists going on to this kind of niche area. And it sounds like you had a personal experience that informed that. But if you could tell us more about that, that'd be great.
Sure. Yeah. So, like many people in medicine these days, I had a really rough time getting through med school and residency. I was exhausted all the time. Um, I spent a lot of time, learning defensive techniques to spend as little time doing other things and as much time sleeping as possible and stuff like that. And I just thought, okay, I'm tired. I went to the health clinic. They said, "Oh, you're just depressed. Here, take these antidepressants." It was all that, and everything's normal. Your thyroid numbers are fine. Go away, And I went to residency. I did a 5-year surgical residency in otolaryngology, learned to take out voice boxes and thyroids and do sinus surgery and all the things. And so when I was done with residency, I decided not to go into academic medicine. I went back to private practice and worked as an employed doc and then started my own practice. And I had been out in the private world for, 3-4 years. And I first figured out, hey, you know what? Surgery doesn't fix everybody. I need to learn some other stuff. And so I went and got a fellowship in allergy, which is a common thing for otolaryngologists to do. But what isn't common is that when I started going to the allergy conferences, I went on to a sidetrack and I'm like, you know what? I want to learn a little bit about this other topic. And I went into one where they were talking about thyroid. And the guy said, you can have thyroid symptoms and have a normal TSH. And I was like, what? And he put up this list of symptoms. And I swear I had to pick my jaw up off the floor because I had 9 out of 10 of the symptoms that were on that list. And of course, a normal TSH. And so I went home from that conference, went to my family doctor and said, hey, I'd like to try taking Armour Thyroid. That was what he recommended at the time. And by the end of the first week, I was like, holy cow, is this what normal people feel like? It was it was so different. It was so different. I was already, doing thyroid surgeries. I'd already realized that when I took somebody's thyroid nodule out, by 6 months later, they felt worse. They were gaining weight. They felt foggy in their brains. Their hair was falling out, their skin was coarse, all the things that low thyroid does to people. And I was like, well, didn't you go to your endocrinologist? And they're like, yeah, they said everything's fine, and that would keep on. And 40 pounds later, they're just miserable and their TSH is still okay. And I'm like, you know what? I'm going to try as hard as I can not to do these surgeries on people. I'm going to try, went back and looked in my textbooks and there was this, here's how to suppress a thyroid nodule. And so I started doing that, and people, not all of them, but some of them started feeling better. And then I went to this conference and I was like, and I started seeing that list of symptoms in my head with every patient that walked through the door. And I was like, oh, you got sinus problems? Yeah, but your eyebrows are falling out. Can I order some thyroid labs on you? And I started just digging into it more and more and more. And in the integrative medicine world, there are some people who do things a little bit differently than what the mainstream thyroid guidelines are. If any of your patients have ever had that same experience like I had, they will recognize this. Okay, you go in, you tell your story, they check your TSH. Oh, it's all normal. Go away. You're fine. Or maybe they give you levothyroxine and you don't feel better, or maybe you even feel worse. But I found a guy who was teaching a different way to test and a different way to treat using synthetic T3 that seemed to work better than my Armour thyroid that I had been giving people, because it seemed to be for some people better. And the more I learned from him, and I was my own first N of one case,
Yeah.
so I tried his technique on me, and it was like, okay, this works. This, it works on me. And I started offering it to these people with their chronic sinus disease and their, oh, you're brain foggy, you're this, you're that. Oh, so I started offering this thyroid treatment to people who would come in for other stuff, and it became a bigger and bigger part of my ENT practice.
Mhm.
Whether or not you'd had a thyroid nodule taken out of your neck, I was like, you know what, let's try to optimize this. And people would come back and go, wow, you changed my life. I was able to have a baby, or,
No.
you know what, midlife brain fog went away, or this or that. And it just really changed how I thought about doing surgery on people versus treating everything that I see. When I got to where I'm like, you know what, my neck is getting sore. I don't really know if I want to keep doing surgery all the time or not. Then that was what I was like, you know what, I'm going to come learn this. And the techniques are not just centered around thyroid. It's about all the different hormone systems that need to be in balance, which is the gonadal hormones. And all my patients eventually started heading towards menopause. And I'm like, okay, as an ENT, I cannot logically justify prescribing menopausal hormones, but as an integrative doc, I can. And so I'm like, okay, I'll go get the education. I'll learn how to do it. It's not that complex, but when you mix it with thyroid, it becomes a little more complex, because you take thyroid up, then your estradiol goes down, you add estradiol, your thyroid goes down. And so you have to play this balance game with some people to get everything right. But anyway, so that's kind of where things started. And when I decided insurance wasn't for me anymore, this is where I went.
Wow. So to go way back, you were a surgeon trying not to do surgery.
Well, specifically for the thyroid stuff, I was,
Yeah.
because every
Okay.
time I would do a surgery, if it was a patient with cancer, of course I've got to do the surgery. But like, for example, if someone would come in and say, well, I know you need to take out this nodule, but can't you just take out the whole thing at the same time? And I'm
Mhm.
like, oh, no, 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 no. You really don't want to do that, because this is probably what's going to happen.
Yeah.
And then I'll tell you what happened that really blew my mind was I had this woman come in, and she was a sinus patient. She had bad allergies, but she didn't test positive for allergy. So I did a CT scan. Her CT scan was terrible. And I'm like, you need sinus surgery. It's clear you need sinus surgery. Nobody would disagree with me. You need sinus surgery. And she's like, well, but I'm a teacher. It's February. I need to wait till summer. I'm like, okay, reasonable. And I didn't hear from her, and I didn't hear from her. And August 15th came around, and school's starting back up, and she shows up in the office. And I'm like, well, we kind of lost our opportunity window to do your surgery. And she's like, oh, no, I'm not here for that. I just need a refill on those thyroid medicine. My sinuses are all better.
Wow. Yeah.
Blew my mind.
Wait, so talk about the connection there. How does that?
So if your thyroid signaling is off, then your immune system is not as robust as it should be, and it makes it more difficult to fight off infections. So, yeah, that's people don't realize that. Thyroid really affects everything in our bodies. If your thyroid is insufficient, your periods are going to be irregular. If your thyroid is insufficient, you're going to have executive function problems and memory problems. You're not going to build muscle as easily as you would. You're not going to have good gut function because if your GI tract can't move along, then you're either going to have GERD or constipation or IBS. And I've seen all of that get better with thyroid treatment. And it's pretty amazing.
Wow. Yeah. And I just want to, so when I said you were a surgeon trying not to be surgery, like that takes a lot of courage. And I got that you were trying to get at the root cause and actually you know, give a more sustainable option.
I mean, it may be pretty darn old school, but I went through and they said, do what works. Do what works. And, if the surgery you're doing is not making people feel better, why not? Let's do, and one of the things that happened was the pathology kept coming back, this chronic lymphocytic thyroiditis. And I was like, well, I didn't learn what that was in residency. What is that? And I went and looked it up and I'm like, well, that's Hashimoto's disease. And 15% of American adults have Hashimoto's antibodies.
I didn't know that.
10%. It's huge. And a lot of those people are walking around with their normal TSH and their head in a fog.
So how do you even approach that when the thyroid levels come back normal?
Well, the set of labs that I do is a little more extensive than just the TSH and reflex to T4, which is the common set of labs. TSH being thyroid stimulating hormone, T4 meaning the main thyroid hormone that's put out by your thyroid gland. So I add 3 extra tests on that. I add the total T3 and the reverse T3 and then the free T. And free means that's the free hormone that's circulating in your blood and available to your tissues. The total T3 and the reverse T3 are a measurement of how your thyroid hormone is getting either activated or inactivated in your tissues after it comes out of your thyroid gland. And none of us got taught that in medical school. We were just taught, okay, TSH goes up, that means your thyroid is too low. If your TSH is going down, that means it's too high. End of story. That's what we were taught. And the fact is that thyroid hormone has to be processed in your body before your body can use it. 80% of what your body actually uses goes through a processing by certain enzymes in your tissues before it gets taken up into your nucleus of your cells and used to burn for energy or to build muscle tissue or to build proteins or whatever it does. And so you can measure that. You can measure, okay, how much T3 do you have just floating around in your system? And then what's the proportion of what you're keeping and what's getting turned into what's called reverse T3. And reverse T3 is T4 getting basically inactivated and sent to your kidneys to be gotten rid of. And if your proportion of reverse T3 is really high compared to how much T3 you have, you're going to feel rotten. And that has proved to be very, very consistent. And, in science, if you look in literature and you look in research, the only place where they use that ratio, that total T3 to reverse T3 ratio, the only place it really shows up in studies in science is in the ICU. And you can predict who's going to die in the ICU by looking at that ratio. And if it's normal, it's above 10. And if it's lower than that, then that means that that person is inactivating their thyroid hormone. And they will have all the symptoms of low thyroid, even though the other numbers look fine.
Okay. Wow. So
yeah, it's a little bit unbelievable, but it's just so very consistent.
Yeah. And so so I want to mention you said about alluded to your practice, which is a direct specialty care practice.
Yes.
That you founded called Consultants in Metabolism.
Uh-huh.
So this gives you I would say, in my words, the freedom to do these slightly different pathways to get to the root cause and then treat it in ways that maybe are not what you're calling.
Well, and it's even less about the root cause because there is a bunch of root causes of what can cause that particular kind of imbalance. I mean, there's, stress is a big one. Stress really, really drives it.
Yeah.
There's a genetic defect that 15% of European descent people have that causes you to not effectively make T3 in your tissues, in your peripheral tissues. And then Hashimoto's is a big, big one. Hashimoto's really, and we can theorize about why that is, but Hashimoto's is a big one. And then the other reason why that happens is a high exogenous dose of levothyroxine.
Hmm.
Because the more levothyroxine you have, it's like your body feels that signal and turns a switch to make more of it into reverse T3. And the more you take, the worse you feel. And so it can be a real challenge. People will come in and they're on 150 micrograms of levothyroxine. And I'm like, and you take that once a day, do you? Yeah, that's the normal way to take it. And that single high dose, people don't think about this. Levothyroxine, when you take it, they advertise that the half-life is really long. And what that means is that it sticks around in your body system for a really long time. As long as a week and a half to 2 weeks is what they say. I think it's more like 6.5 days, but still, semantics. But what happens when you take, when thyroid hormone is coming out of your thyroid gland, it's the same level more or less all day long. When you take a pill and it gets absorbed in your stomach and all of it gets absorbed in the first 2.5, 3 hours of after you take that pill, you have this great big spike. And then you go back down to that baseline and then a big spike and then back down. So that once a day dosing signals your body that you have too much thyroid hormone. And your body's designed to fight that because Graves' disease, which is, hyperthyroidism, Graves' disease is a deadly disease. It kills people. And so your body fights that by inactivating the T4 that you take into reverse T3. And once that enzyme gets turned on, it stays on. And it stays on for sometimes weeks. And so it
Yeah.
takes a little while for that to calm back down once you lower that dose. And you can do it in a couple of ways. You can say, hey, you know what? Just take that pill and break it in half. Take half of it in the morning, half of it in the afternoon. That lowers the peak by about half. The trough stays about the same because you're taking the same total amount, but the peak goes down, and a lot of people will improve that ratio just by doing that one step. But a lot of people come into my office overdosed.
Wow.
And the standard way that labs are done is that you take your thyroid medicine today and then you don't take any more until after your lab set, which you do tomorrow. And so it may have been 27, 30, 34 hours after you took your thyroid pill before you get your lab test done. And your lab test is a snapshot in time. And so not only is it showing the low end of where you usually are, it's showing lower than the low end of where you usually are. So if you're overdosed in that 3 to 4 hours after you take your pill, it totally misses it. I do my labs a little different. First, I have them divide the dose, and then I have them go to the lab exactly halfway between the trough and the peak. And if you stick with that schedule and you do it the same way every time, people start to feel better. And it's pretty amazing.
I'm sure. Wow. I just want to incorporate specifically thinking about as we're aging and hitting menopause. How do menopause, thyroid dysfunction, and testosterone decline intersect to speed up cognitive aging?
Oh boy. Okay, so this is in the news almost every day right now. Is that they've really done a lot of studies on uh, premature ovarian insufficiency or primary ovarian insufficiency, which is when you go into menopause younger than age 40. A lot of studies have been done on people who lose their estrogen in those early age groups, and there is a dramatic increase in dementia and heart disease and bone loss in those people, and putting them on estradiol really, really helps. But what they don't say is that there's also a dramatic increase in the onset of Hashimoto's disease. And so there's kind of the tie-in is that thyroid disease can come at any age, but it's very, very much more likely to happen right after a pregnancy or during the perimenopausal time period. And so it gets in there and confuses the picture for a lot of people. And if you have insufficient thyroid, you have trouble building muscle and you have cognitive effects that we can talk about more that are not emphasized really very much in the literature. If you look, there are changes in, and these are studies that are particularly done on people who get treated with levothyroxine versus people who get treated with T3 combination therapy, that they will lose more weight, that they will feel more mentally sharp, that they test higher on quality of life score questionnaires, that their cholesterol goes down, their liver function tests, if they are elevated, will drop as well. So there's lots of physical markers that indicate that things are not right with thyroid, even when the TSH is in the normal range. And as of this moment, mainstream literature is not really focusing on the fact that it's possible that this combination of the level of T3 versus reverse T3 has anything to do with it. But in my hands, it feels like I can reverse it very consistently. And, I can't wait to publish some, case series and see if I can get somebody interested in actually doing some kind of a prospective clinical trial that shows what I'm seeing. And it's not just me, it's the fellow that taught this to me and all the other people that he's taught. We all do this same technique, and it's just very consistently worked very, very well. But you have to realize that the stimulus to produce thyroid hormone comes from your pituitary gland. The stimulus to produce sex hormones comes from your pituitary gland. Stimulus to produce growth hormone comes from your pituitary gland. And so when there's one other one, which is cortisol, and the stimulus for cortisol also comes from your pituitary gland. Because cortisol is the survival hormone, upregulating the production of cortisol tends to downregulate all the other ones. Because our primitive bodies respond to stress by conserving energy. And how do they conserve it? They conserve it by, hey, we're not going to reproduce. Hey, we're not going to feel warm. We're not going to build a lot of muscle. We're going to hibernate. And so when you add the stress of going through perimenopause with those severe hormone fluctuations, the fluctuations themselves add stress to the system and push down on the other hormones to make things more turbulent. And when you don't have energy, you don't want to go to the gym. When you don't want to go for a walk, you don't want to spend minutes eating healthier food, doing the self-care, all the things.
Yeah.
You just don't want it. So it becomes this downward spiral of now you have more insulin resistance. More insulin resistance means higher baseline blood sugars, which damages brain cells and all the other tissues in your body. So it's a very complex symphony of stuff that's going on. And if you miss the thyroid part of it, then people will not necessarily feel all the way well. And I had a lady yesterday tell me, oh, yeah, well, they put me on menopause hormones and it didn't make me feel any better. So I just quit. And 30 years she's gone. And now I've gone and said, oh, well, your T3 or T3 ratio is 5. It's supposed to be 12. Let's see what happens. And she just started. So we'll see what happens. It's pretty remarkable the difference that you get in the ability to build muscle, in the ability to have energy, to feel warm enough that it's okay to get out of bed in the morning. There's just a lot to it.
Yeah. Can you give an example? This is the Resilient Aging Unfiltered podcast. So can you give an
Yes.
example of, an older adult that's had a turnaround or positive experience?
Sure. So I'm going to use this example of a lady that came to me for allergies a long while ago. And she was not that old. I mean, she was probably early 70s. And I said to her, ma'am, I think really next time you come to see me, I would like you to bring a family member with you, because she could not remember what I was telling her. She could not follow instructions. She could not follow through. I mean, everybody knows somebody who's like that, who tells you the same story 5 times and doesn't remember they told it to you, and who has trouble with executive function, following instructions, doing anything that's complex. And I decided, I think it was because her hair was thin and her eyebrows were falling out, I decided to do a set of labs on her thyroid and got her son to help me put her thyroid pills, because we found that bad ratio, put her thyroid pills in her little pill box every day. And a month later, she came back to me and it was like, who are you? And what did you do with Mrs. Jones? Because she was so much better.
Wow.
And as long as we kept her thyroid properly balanced, she stayed sharp as a tack. And the minute it got off again, like she went into the hospital for something, they took her off of it. We basically had to start over.
Mhm.
It was very frustrating to me, but that's not the only time that's happened. I had a lady yesterday. We did a minor adjustment on her thyroid hormone. She had been on too much levothyroxine, and we went down and down and down. And finally, I changed it last month. I changed it from 75 micrograms a day, 2.5 micrograms a day, which is something she's now dividing it and breaking it up into 3 parts. And she was like, yeah, when I did that, it was like flipping a switch. I can remember where I put my keys. I
Mhm.
remember my kids' birthdays. I've got so much energy. I'm now cleaning out the attic. And it was just like, oh,
Wow.
that just makes my heart flutter when I think about it. It's
Yeah.
just like she really thought she was starting to have dementia.
Yeah.
And she said, and I'm going to the gym 3 times a week. And, da, da, da. And I'm like, wow, she's making avocado. She's 80. She's making avocado smoothies and going to the gym and lifting weights. And I'm like, dang,
Yeah.
this is a lady who 3 months ago, she thought she was done.
That's incredible. I as an Alzheimer's specialist, likely to see someone like that.
Mm-hmm.
And I try to be comprehensive and holistic.
Yes,
But it sounds like she did look like she could have Alzheimer's disease.
she totally did.
And then even,
And I was really, honestly, really worried because I had already taken her down and down and down and down. And it was just one more little thing. And then it was like, oh, now, and the labs show it. The labs show it. It's like, okay, now her T4 is not too high anymore. Boom, now she's good.
yeah. And it's possible, just want to mention that she could have some Alzheimer's changes in her brain that are more vulnerable to these thyroid, hormonal dysfunctions. And
Yes.
so
Oh,
you,
I believe that.
like maybe
Absolutely.
you turn that around and changed your whole life. Like that is so
Well,
incredible.
I changed her life this month. Who knows what's going to happen
Well,
next month, right?
yeah, true. I guess that is can be a little unpredictable. And I wanted to go back to this topic of strength training and muscle
Mhm.
building.
Yes.
I'd love to, yeah, if you could talk about, we just did a live webinar called Strong Thighs Save Lives.
Awesome.
The importance of especially strength training and resistance training as we get older. Well, yeah, if you could speak to that and the Lift More trial that was mentioned in the webinar and
Yes.
your view on that and how you incorporate that.
Well, okay, I'm going to use myself as an example because, when I first figured out, hey, I need to be taking thyroid hormone, I had those fatigue problems and those cold problems and stuff. I'd had them since before high school.
Hmm.
I'd had them for a really, really long time. And when I was younger, I really wanted to be a gymnast. I mean, I turned out to be too tall to be a gymnast, but I really wanted to be a gymnast, but I was never strong. And I worked and worked and worked and worked, and I could never do a handstand. I could never do a handspring. I didn't have the upper body mass or strength. I was always the skinny girl, never could build any muscle. And I just accepted that as that's who I am. Just like I accepted that I was cold natured, that my hands and feet were always freezing. Um, so here I am in my very late 50s now. And I was like, you know what? I think I want to get healthier. And so during COVID, actually started right before COVID, I started going to a weightlifting gym with my husband. And it's like, oh, Well, and it took a long time because the best time to start lifting weights is when you're in your teenage years, but your mid 50s, I guess, are the second best time. But anyway, I mean, it took me 5 years. And finally, this year, I'm like, oh, I'm having to buy bigger shirts because my shoulders are big now. Not a lot big, but just,
Yeah, yeah.
that my shirts are a little tighter than they used to be. I, about a month ago, was able to squat 100 pounds.
Wow.
And I never thought I would get there. I mean, I started with 10 pounds,
Wow.
you know,
Congrats.
and that's just me. And, I went my whole life thinking I couldn't be strong because of my experience with my thyroid. And then all of a sudden I'm like, oh, well, maybe I am a strong person, and it's this total mindset turnaround
Yeah.
that I've had. And it's not just my legs are stronger, it's my back is stronger. My grip strength is stronger because I can pick up a bar with 160 pounds worth of weight on it. Uh, it's there's there's a lot of mindset changes with knowing that you're strong enough to pick your own suitcase up and throw it in the bin on the airplane. You know,
Yeah. Can you speak to and with like insulin resistance and other
sure.
benefits?
So there's a lot of metabolic benefit. I mean, besides the fact that any exercise that you do increases the blood flow to your brain and improves your brain function in that way. The more muscle size you have and the more strength you have, the more of the carbs that you eat go into your muscles and get absorbed by your muscles. So that helps lower insulin resistance because you just have this reservoir
Mm.
of muscles which are great for absorbing sugar and then taking them to use them when you go for a walk later or when you lift next week or whatever. And that's called glycogen. That's what the sugar that gets stored in your muscles is called glycogen. But the other things are resistance training, especially when it's really heavy like that. You don't have to do a lot. You don't have to do a lot of reps. You don't have to do it until you're sore, which I think is great because a lot of people are like, oh, well, no pain, no gain. I'm like, no, you do not have to work out until you're in pain. That's dumb. That's ridiculous. You don't have to do that.
Great.
But so the way I was taught to do them is you do low reps and you go rapidly to the highest weight that you can lift 5 times
I
without
see.
stopping. And you do longer and longer rest periods in between those. And if you're over 50, you should certainly do rest breaks, not just rest breaks, but actual recovery days. And I mean, and there's a lot of evidence now that that's really beneficial. I mean, this Lift More trial, you and I were talking about the Lift More trial before we came on camera. This is a study that they did with postmenopausal women who had never weight trained before, and they put them into a weight training program for 12 weeks, and the control group did some other kind of exercise, but it wasn't weightlifting. And not only did the women, I mean, just 12 weeks. Not only were they stronger, they were able to balance better, they were taller because their backs were straighter. I mean, it's yeah, I mean, it's just like if that's what the results you can get in 12 weeks, what can you do if you do it week after week after week after week? I go in my gym and I'm just put to shame. There are 85-year-old ladies in my gym and they kick ass. It's
Yeah.
just like
Yeah.
I'm so excited for them because they are sharp as a tack. And they're like, "Oh, I have to hurry today because I got a bridge appointment and I'm going to go."
Yeah. They're gym rats. They
They
can
are
be. They're not working full
I mean,
time.
they're not there to stay. They're not there to stay. They're there to get it done and get out
Yeah.
because they got things to do.
Yeah. That's amazing. What about I was going to say thyroid function impacted by weight training?
I really don't think that I could have built the muscle mass if my thyroid was still in the state that it
I see.
was.
Yeah,
I really don't think, like I said, that's why I
that makes
got
sense.
this mental idea that I was not a strong person. And I don't think without the thyroid being adjusted that I could have changed that.
Okay. That makes
I don't
sense.
know that I would even be alive if I hadn't changed it. That's really because I mean, if I drop it, I feel so bad.
Hmm. Got it. So can you share, I guess, as we're getting close to the end,
Yeah.
and again, thinking about as we're aging, what lifestyle factors besides weight training are most important for people to have or try to have their hormone levels in check and have energy
Sure.
versus the opposite? What's going to be
Sure.
mental?
Well, uh, I will tell you, I think, you need to mix your weight training up with some kind of aerobic exercise. And a lot of people say it has to be zone 2, a little bit less picky about that. If somebody's just starting off for exercise and they want to start by walking 10 minutes a day, I'm like, by golly, go and walk 10 minutes a day. You can always raise it later once you get the habit going down. So I think social contact, oh
Hmm.
my gosh, so important
Yeah.
because, I mean, I see people move from, rattling around in their big old house and they're like, you know what, this is dumb. I'm going to move to a community, one of these active
Hmm.
adult
Yeah.
communities. Like, don't wait until it's like, okay, now you need help with your meds and stuff like that. Go to this active adult community while you are still independent, while you still drive yourself, while you still have your gym membership and you're this and you're that. And just the attitude difference from before versus after, and it's just they're just more on point. This is not a scientific test that I'm doing on them. I'm just like, wow, you're really looking good today, Mrs. Jones.
Yeah.
You really got it. And it's like, yeah, it's community. So that's a big one. And then, boy, these menopausal hormones and the data now is really showing more and more that, particularly for bone loss, if you start replacing menopausal hormones 2 years before onset of menopause, then you get much, much better results as far as the amount of bone loss and the the blood levels that you're shooting for. They've really recently come out with a study that says you're really shooting for a bit of a higher blood level than shortest, lowest amount that relieves your symptoms kind of thing. That's what
Hmm.
the kind of dogma was, is that you should do it for the shortest amount of time and the lowest dose. And I'm like, no, man, I want to do it to the best. I want to optimize that bone health because
Yeah.
that's going to keep me from breaking my hip and getting bent over to the point where
Mm.
I can't walk straight and can't breathe and all that. So I see that. And truthfully, most menopausal women don't need to be on thyroid hormone. I'm not here saying I think every menopausal woman also needs thyroid hormone. I'm saying just TSH and T4 miss a lot. And I don't
Mm.
have data on that because they're missed. I don't have data. They show up in my office, but I don't have data on what percentage of the adult menopausal population that is that got missed or got told, oh no, your TSH is fine, go away. But consistently, I see people go from, I don't tolerate that medicine to, oh, I actually feel good now.
Hmm.
And it's a it's a balance. It's like if you start somebody on thyroid, you can expose the fact that they're in perimenopause because having higher thyroid binding proteins in your blood
Mm.
also binds up your estradiol. And so then you have to raise this one and then you have to go back and they balance each other. Stress management is also another
Mm.
huge, huge, huge
Yeah.
step. And it may not just be meditation or, go get some self-care, go get a massage. I mean, it's just dumb little things like take 2 deep breaths before you answer somebody if they say something that triggers you.
Mm.
You know,
Mm.
do breathing where you breathe in slow and out fast and then out slow and in fast and alternate those, and do 10 breaths a day. It's just any little thing that you can do that downregulates your stress system improves your thyroid function before you even take a pill.
Fun. That's huge.
So stress is big. And of course, having your hormones fluctuating is very stressful.
Mm.
Ask me how I know. I did not have the easiest menopause transition, I just have to say. I did not go to somebody who turned out to be as educated as I would have liked them to be, and ended up with a hysterectomy and my ovaries out. So now I'm 100% dependent on outside
Yeah.
hormone sources. And, you know, not going to cry over it, but I wish I would have done things different. If I'd known things different, I would have done things different.
Yeah. Well, that is so powerful. And knowing all that you know and didn't end up having the experience that would have been optimal.
Yeah.
If you could, if, many of us want to know. So if we're, in that perimenopause, menopause, or, andropause and
Well,
having some of these symptoms and we don't feel like we're getting heard by our healthcare professional, providers,
oh boy. Yeah.
what do you recommend? I mean, I want to hear about how people can find you, but also,
Sure. So what I recommend is to find somebody who has some additional training in perimenopause, menopause care, and not just a pellet academy, because I really do have a lot of negative things to say about pellets, especially when it comes to um, having somebody try to balance their thyroid while they're on pellets. It's like, okay, while your estrogen's at this level, then your thyroid goes this way. And while you're at this level, then it's like your thyroid is going up and down with your menopause hormones if you're on pellets. And you never can get them balanced out right. And it's just like, yeah, so try to pick a provider that says they have extra training in menopause from somebody who's legitimate, like the Menopause Society or the ISHWISH, which is the International Society of Women's Sexual Health. They have great training courses. Heather Hirsch has a great training course. So ask your provider where they learned how to do menopause hormones
Mhm.
and how recent they learned it, because the science is evolving literally every day. A new paper comes out, a new study comes out. So that's the first one. And then the second one is there's this set of 5 labs that I encourage people to have done about thyroid, because it's not everybody, but okay, if it's 15% of Americans and half of those are women, so it's probably closer to 25 to 30% of women who have had or still have damage related to Hashimoto's disease. And it's like, if you see that ratio and it's 6 or 5 or 4, then you know you got a big problem, because that ratio needs to be at least 10. And if it's not, then there's room for improvement.
Got it. Thank you. So now can you tell us where do people find you?
Sure, sure. So, as far as learning how to do that lab set and interpret that lab set, I really got very frustrated recently, and I put together a course on how to order your own labs and figure out whether you have this problem or not. And I put that online at danagibbsmd.com/checkup. It's the program is called the Thyroid Clarity Checkups. Um, I am going to run that live again, probably in January, and
Awesome.
pretty excited about that. And then my website is just danagibbsmd.com. And if you are a clinician and you want to know more about this, I did a webinar this summer that I'm going to re-record and put on my website. And it's called When Normal TSH Isn't Normal. And it will be on my website under the same danagibbsmd.com/TSH. And you can get on there and watch all those little videos that I've done. I think my mentor, I think Alan, is going to do his course. He retired just about a month ago, but I think he's going to do the course again this spring. And he's promised he's going to write a book. I can't wait, because I've been doing this for 20 years. He's been doing this for almost 40 years.
Wow.
Yeah.
So the thyroid clarity course, I think that's what it was called, that you might be having a live version in January, or you are?
So what it is, it's kind of an asynchronous plus live because
Okay.
the modules are recorded, but then I do a live session where I answer questions and people can volunteer, bring me their labs, and I'll say, okay, let's run through the analysis protocol and I'll tell you where I think you are.
Cool. I love that.
And it's gonna be fun.
Okay, great. Well, we'll have all that information in the show notes, and then your practice
And I do see
consultant.
one-on-one patients, obviously,
So
and
that's
that's on the
consultants in
website too.
metabolism in Texas.
Yeah, it's Consultants in Metabolism. It's Texas, and the website is just danagibbsmd.com.
It's all there. Okay,
It's all
great.
there.
Any
And I
final
have a
words of wisdom?
podcast. I'm on
Okay,
Instagram.
great.
I
Nice.
answer I answer questions on Good Self once a week, Tuesdays at 12:30 Central.
Nice.
And usually I pick a topic, but I'll field any question.
Okay,
And the
fabulous.
Good Self app is free, so anybody
Okay,
can
good
come on
stuff.
there.
Got it. We'll include that too. Um, well, firstly, thank you for what you do, because there's such a need, and so many people feel like they don't have a home, and they're not being heard and validated for what their real experience is. So thank you for doing that,
Oh,
and bringing
you're
in all
welcome.
this different expertise and life experiences. It's so powerful.
Yeah.
Clearly, you're passionate, and that's really led to countless benefits to your patients, I'm sure, and to your students.
Thank you. Thank you so much for having me. This has been
Yeah.
great.
Great. Well, thanks everyone for joining today, the Resilient Aging Unfiltered podcast. What a great conversation. And there's so much more to say about this. And I hope we can have you back sometime, Dr. Gibbs.
Oh, you bet.
Great. So, everyone, please, as always, like, subscribe, rate, and review. Find out more about Brain Love for holistic modern care and Alzheimer's and related diseases. And come be a patient with me and with our team at mybrainlove.com. All right. We'll see you next time, everyone.